Hi, I'm Dr. Jimmy Gutman, and I'm standing in front of the Montreal General Hospital, one of several teaching hospitals at McGill University here in Montreal, Canada. McGill University is considered the top medical research facility in Canada and one of the top worldwide. You may recall that Dr. Gustavo Bounous, the discoverer of Immunocal, started his work right here in this building over 40 years ago. So here we are 40 years later, and the excellent research on Immunocal still continues. Today we're going to be looking at the Prehabilitation Clinic, started by Dr. Franco Carli, along with his fantastic team.
Rehabilitation medicine is preventative and not reactive. So prehabilitation is before the event stress. Rehabilitation is when you recover, rehabilitate the patient of stress. That is the difference.
I've had the honor of knowing Dr. Carli for over 10 years, and it's truly amazing to witness his work and understand the impact he's had on his patients. Dr. Chelsia Gillis is the current research director of the Prehabilitation Program and has published quite extensively in the field.
Institutions that don't have a prehab program, what happens is that the patient gets a phone call, they come for medical clearance, so they spend about a half day at the hospital and go through all of these tests, and then they sit at home and wait and stress for their operation. With prehabilitation, we use that waiting period so that they can be actively involved in their recovery and not sit at home and stress as much.
Nutrition is a fundamental pillar of the Prehabilitation Program. Proper nourishment before surgery can make a significant difference in how patients recover, reducing the complications and accelerating their return to normal life. One key supplement that's been extensively studied in this process is Immunocal. Dr. Carli and his team have used Immunocal in dozens of studies.
Nutrition interventions are definitely key, and that's because about 1/3 of patients are malnourished before surgery, and malnutrition is associated with adverse surgical outcomes. So we need to treat these patients early with nutrition. Whey protein has a really high digestible, indispensable amino acid score. So the whey protein is consumed and immediately those amino acids are available for protein production. And if you are missing just one essential amino acid, protein production stops. And now what I really like about the Immunocal product is that it does not have any fillers or junk. It's pure whey protein.
Exercise strengthens physical endurance, helping patients recover faster.
The benefit will be, first of all, is that the patient is fitter to be prepared for surgery, so and recover faster. Second one, complication rate is reduced, visits are reduced, less ICU admissions.
However, a well-rounded prehabilitation program goes beyond just nutrition. While proper nourishment, including key supplements like Immunocal, play a vital role in preparing the body for surgery, true resilience comes from a holistic approach.
So we do a questionnaire when we know exactly where they are, and then we have a psychosocial nurse who can contact them and give us some sort of strategies, yoga, meditation, visualization, all techniques that are very useful.
At McGill University, groundbreaking research has always been at the heart of what we do. For decades, this institution has been a pioneer in medical innovation. With proper nutrition, including Immunocal, along with exercise and mental preparation, they're not just facing surgery, they're preparing to overcome it. This is the future of medicine, and it's happening now. I'm Dr. Jimmy Gutman, and thank you for joining me.